We're here this afternoon to just talk about the feedback session from this morning. So let's start off by just getting a brief history of this child who I think is 2.5?
2.5.
2.5. So how long has he been in therapy and what is that therapy?
He was diagnosed last year, 2011, in October with autism. And then he started receiving therapy in November. And he gets two sessions, 30 minutes each, of occupational and speech. And then he comes in for a study that we're doing in the behavior analysis lab for 2 hours a week.
Okay. So fairly minimal intensity of services, although Mother says that in a month he's going to start a 30-hour-a-week program, so that'll change for him. But right now, in terms of what we saw this morning, we did the ESCS and we did the structured play assessment. And for a little guy like this who's very dysregulated, there are a lot of environmental changes we would want to have happen. Can you identify some of those changes that we didn't have access to in this situation, so we made the best out of it? But if you were going to see him and you were going to do an assessment, what would you have done differently?
I think we know that the table and chair situation was not ideal.
Right.
So somewhere where he can hold himself up a little bit better, have a little bit more support, have the right height,
Right.
not be on mom's lap.
Right. So sometimes really young kids are on mother's laps, but in this case, he's really fighting against that, and he's seeking sensory a lot, especially when he can't do the activity. And he's also has his arms against the table, so his hands aren't free to actually manipulate the objects. So that wasn't ideal. But we started off with the ESCS, which I think was a harder test for him. Would you agree?
Mm-hmm.
So he was much more dysregulated. So, we don't know him. Might have started with the play, but then we would have still had a problem transitioning to the ESCS. So either way, I think we gained a lot of information about his abilities right now, his reaction to a new situation. So maybe we can watch for a few minutes and then just talk about what we're seeing.
Sure.
Okay.
You're okay, buddy. Look, Nina, what do you want to play with?
Okay, so right away there are too many people talking and too many people moving, right? And that happens when kids sit on mom's laps and they're already dysregulated. So that we would want to change. But the minute that the toy comes into place, he settles for a moment, right? So we can start it again. Okay, so you were doing the assessment. Did he look at, so this camera angle, you actually can't see if he's looking at the therapist, which would be really important to know, but you were there. So.
Right, he didn't make too much eye contact even to request the objects.
And you see mom is giving pressure on his head, right? So
And
she's,
that's something new, too.
that's something new, right? So she's trying to get him to perform the best he can. And it actually is probably interfering a little bit. So, if we could settle him before we got started, that would have been best. But he did settle for moments. He participated for what, a second maybe?
Yeah, I mean, sometimes I think it's better to just bring out the toys and start, and a lot of the kids calm down. So I think that was my strategy.
And he did a little bit. So let's.
Can I ask a quick question? The throwing of the toys, do you think that was part, my interpretation is part of it, he didn't even know what to do with them. So when
Yeah.
it's almost like you presented it to him, he didn't even know what you were asking for, and his reaction was just,
Right.
I don't know what this is, and I don't know how to play with it, so
Yeah,
Yeah.
not
I'm going to
an
get rid of it.
Right.
Right.
Not an intentional behavioral act, but just
Right.
kind of,
Yeah,
yeah.
I agree.
Yep.
He does do this with his like bottle. When he's done, he throws things.
Uh-huh.
So it's also kind of a way to tell you,
I'm
You're done.
not going
interested.
to engage with it.
Yeah, and it
I'm
usually
done.
works because then
Right.
mom knows, oh, okay, you don't want this, we'll put it away. So,
It's his way of saying, all done.
Yeah.
Yep. Yep. Okay.
Good job! What do you want to play with? Yeah, the crab! Yay! One more. Here you go.
Is there a section you want us to go to?
Do you remember when he did the reach?
Is it a bunny?
It may have been. I think one of the ones are the bunny.
So far, he hasn't shown us, and actually maybe we could just turn the sound off here and we can just watch it, because he actually makes a few vocalizations, but he doesn't have words that we heard, and he doesn't make a lot of vocalizations. So if we just turn the sound off, and I think we just let it run through, we can talk over it. That's one way to do it. It works.
I know it's coming from the camera.
Oh, it's coming from the camera. Ah, yeah. So, he gets interested for a moment, but so far the kinds of skills that we're looking for with the presentation of toys is, does he show us any requesting? Does he show us any joint attention? So what are those behaviors? A point, a show, looking between an object and the person, making sounds, following directions, turn taking. And so far, he hasn't been able to show us much of that. Part of his problem is he's got his hands down. And so it's possible that he has more skill than he's able to show us. And that's almost always the case, right?
There was one point where the toy's in front of him and he sort of like pushed it forward towards you. And
Yeah.
I'm wondering if he was like,
Yeah.
if he had the ability, the dexterity to just hand the object if he would have in that moment.
I saw that too. I thought at one point he was trying to give it to me to get rid of it, kind of.
So he shows some interest, and there he looked at you. So he shows some interest. He's showing a couple of looks. That's great. That's potential. So, and he's trying hard.
So when he looked at you, then you gave him the toy. That was on purpose, yes?
Yeah, I mean, at this point, I feel like he was probably making eye contact to request, so then I would just give him the toy.
So that was kind of, she said, give it to me,
Yeah, I think
and
that
he
was-
kind of did a little fling there. And now he's completely dysregulated, right?
yeah, that was his second.
So one question you might ask is, well, why are we giving him toys when he's so fussy, right? But it's an assessment.
Right.
And we're trying to, get whatever his potential, whatever the possibilities are.
You can even see the way he's sitting, and his legs are straight down. He really doesn't have any of that stability to hold himself. It's so hard for him to even be sitting like
Correct.
that.
I think so.
It's hard.
I think so. I think it's also an escape mechanism, because whenever we
Right.
do these kind of tasks, and there's like food and there's TV and there's these things involved, he can sit on mom's lap just fine. But it
Right.
ends up being that when he does either the spaghetti, or he gets really stiff when he
right.
doesn't want to do
Mhm.
the task. So this stiffness, or like this kind of like spaghetti, comes from I'm done. I'm not going to do whatever.
So that's good information, right? So you've already seen some behavioral behaviors from him that you can interpret. He also might have been able to stand, and that would have been fine for him to stand as opposed to sitting on mom's lap. It just depends on whether he would run. But again, you want to have the equipment to get him seated in a chair and a table as best as you can. Even with the sort of difficulties with that, you get a sense of what he can do because we also have the next assessment and the one with mom. And so is there consistency across these 3 assessments? So from this assessment, what would we would actually we videotape and we would go through and we would code his behaviors and we'd get a sense of where he is developmentally on joint attention and requesting and social interaction. You've watched this, he's got fairly consistent behavior. Where do you think he is in terms of what his pre-linguistic gestures, which ones he can use?
I'm so biased, I can't.
I think he's able to, we saw that he was using eye contact to request some kind of attention or interaction. I don't think he's coordinating attention.
I don't think he has any symbolic play.
Yeah.
Yeah, he doesn't have symbolic play for sure, but
Functional
watch.
play, really.
We'll watch his
We
play
didn't
next.
See a lot of functional play there.
Right.
Wasn't.
Yeah, but I'd say the behavior requests are probably emerging.
Okay. What do you think?
Yeah, I agree with that. He had a brief reach, which is kind of a prereq VR skill. So, if you look in the manual on page 9, or what page is it?
13.
Page 15, you can look at kind of some different profiles of individual children, and he probably fits in to profile 1, I would say.
Do you want to read that?
Yeah, the child profile is no BR, maybe he had a little bit of BR, and also no joint attention. So we would want to target a BR point and also a JA point or give. And then for the interventionist behavior, which we can talk more about tomorrow, what we would want to do is model the target JA skill. So we would want to model a lot of points. If we were programming for joint attention, then we could maybe target a BR point. We're not going to talk too much about programming for joint attention, but I think for now, if we model the joint attention point, that would be helpful for him.
So when we talk about targeting, some of it's just what we do, what we model, without expecting output from him, because modeling, especially with a child this young, children will pick up naturally. But if we force it, we may lose him. So it's all a piece of the larger engagement that we'll work with on him. You can see when he's has moments of regulation, and then he picks up the toy and he's just very interested in the toy, right? So he's very object focused. So have we seen enough of this particular assessment? Or do you guys have questions about anything that Amy did in the assessment? The fact that you would do an assessment with a child who's this dysregulated or that isn't really showing a lot of the pointing or the showing. Okay. Still important to test and to find out where he is.
And one thing that I think I would do differently if I did this in the lab and not for training purposes is that I would go much faster than what I did. I wouldn't ask him every time, what do you want to play with? Technically, you're supposed to, that's part of the assessment, but it was pretty clear at some points that he wasn't doing that. So I would just, bring out the toys very quickly and see if that would help to speed it up a little bit.
So clinically, that's what you would want to do, yeah. Let's see if we can put in is it just next? Maybe he's got clapping, which is great. And a lot of interest with toys. He's trying to mouth the toys some, right? Because developmentally, that's kind of where he is.
I mentioned that he's a kid that always has something in his hand.
He likes to hold.
He likes
Yes.
to always hold on to something.
That's right. And that's great, because he shows some interest in objects. So it's not completely absent.
Can it also be sensory seeking as well?
can
that
be.
having that feeling in their hands, because I know
Right.
that a lot of my kids do that also, so kids that are even developmentally a little bit older, and they just, it's that sensory, they get the sensation through their body and the proprioception, and it helps regulate them a little bit more. So I even noticed during speech sessions, even if we're working on something, you know, that they don't have to use their hands, I'll put something in their hands, and it actually helps regulate them a little bit more.
Yeah,
So
yeah.
that it's just something to think about also when you're doing, you know, therapy side to it also.
Right. So individually with any child, you might do a lot of different things. This child is using sensory seeking a lot of different ways. He throws his head in some very sort of not functional ways, and so we would want to shape that. So even though this is a very developmentally based intervention, we recognize the importance of the behavioral strategies, but even the behavioral strategies we choose are going to be developmental. So for a child who's 2.5, who's learning how to regulate his emotions and his behaviors, we're not talking about high-level strategies. We're talking about what a typical child would use in about the first and second year of life. So that means that it's a lot about the way we scaffold the situation and set up the environment for him and help him to regulate. So he can't do it on his own. We have to help him do this. But he looks like a child who would be really responsive to some pretty simple strategies, which we will try tomorrow.
Mom was looking forward to that.
Okay. The play?
No.
No, we don't need volume?
No.
Because he is not really using
Doesn't really
much
say anything.
language, so we can just talk over it. So,
I wanted to ask you a question. You said that he would go faster. Why? Because I heard his therapist, well, his regular therapist, mention that he wasn't showing a lot of skills that he already truly has.
oh,
So, you know, looking from the clinical standpoint,
Yeah.
Why would you go faster? What if he's a child that just will show you and he's slow to warm up? And because that brought, you know, it came to my attention when they mentioned there's a lot that skills that he does have and he's just not displaying them.
Yeah, I mean, that's definitely important to think about. I think it depends on the child. I probably could have tried to speed up part of the assessment and see if that helped. Just because he was so dysregulated, I didn't want him to have to sit there for an extended amount of time. If he was regulated, I would have slowed down even more. So I think it really depends on, first, the child and also the situation that the child is in that particular day.
yeah, what you're trying to understand is what skills does the child have. So you probably wouldn't rely on just one assessment. So actually when we watched the play assessment, I think he liked the toys more. And if I was just clinically trying to pick targets, I might just do the play assessment and add in a few of the joint attention behaviors like the pointing, just to see where he is in both with just one assessment. Okay. So the first set, you're just putting out the toys to see what he does, whether he can combine toys. So again, flinging the toys. But you can see he's a little more interested, in part because he likes blocks, right? We've heard that he likes blocks. So right away, if you go with his interest, he's more interested, right? We've got things in there that he kind of knows, he's seen those before, understands. Oh, she does? That also helps. That's something familiar. But what he does is he just picks them up, he looks at them, he can combine them bilaterally, you know? I don't know, I haven't seen him combine two though yet. But he can hold one and then he can put his hands together, as right here. He's transferring. And he can clap his hands, so there's all the little steps to actually do something.
Crocodile.
But if we think about, so you probably want to look at your levels of play and think about,
Crocodile.
you know, looking at what he does across all of the different play sets, what level of play, because we're giving him the opportunity with these 4 or 5 play sets to show us different levels of functional play and different levels of symbolic play if you have it.
When you're doing a assessment, now he's fixated or he has an object, and you sort of knew that he was starting to get deregulated, and I noticed that you clean up. And he's got a little upset, but maybe for a child who's actually really into an object, but you know you have to move on to another playset, what do you do in that situation? So where it's time to clean up, or even for a child that maybe doesn't have a lot of language, doesn't understand cleanup tasks, how do you go about doing
So
that?
if that was the case, you can let him hold that one piece of toy from the first set
Right.
and still transition into the second set, and
And then
then
when he puts it down, then
Then,
you can
yeah.
take that one away. Okay, so it's not like you have to
No.
inflate it and take it away from him and then, okay.
I think you want to use common sense
Right,
and the
right.
strategies that you
Right.
have. Because what you're trying to do with any of these assessments is to understand the process. What is it that you're trying to assess? We don't want to prompt him too much, because we don't. Prompting tells us what's possible, which is good. But you also want to at least give him the opportunity to do something spontaneously. If you don't get something spontaneously, prompt him and see if he understands the language, if he understands, a model. That's all good information for you in terms of an intervention target. So, what did has he done anything different with toys yet?
no, he just picks up all the different objects and kind of looks at it. And in set 3, he picked up the mirror and also the brush and kind of mapped it. And that's what we consider a discriminate play act. So basically treating all the objects in the same way, and in this case is mouthing the objects. And then so if you turn to page 13 in the manual, it kind of tells you what kind of information to gather from the SPA assessment. And then so you would think that he would be at the simple play level, because a lot of the skills he was showing was indiscriminate, which the mouthing. And then discriminate, we didn't really see that much. Basically what discriminate play acts are is how you treat the toy the way it's meant to be played. So like rolling the ball is meant to be rolled. So for example, if he had the telephone and he pushed the buttons to dial the phone, those are discriminate play if the button's meant to be pushed. So those type of things you would code it under simple play acts. So from this whole assessment, from the 5 play sets, we've only seen really the indiscriminate play acts from him. So in terms of treatment targets, we would pick toys at that level.
At indiscriminate?
Yeah,
Or
or
discriminate?
discriminate. So a lot of cause and effect toys. Such as rockets or pop-up toys, and we probably even bring out bubbles. And also from the ESCS, we saw that he responded to the tickles. So we'll also be doing, some singing and person-engaged type of activities with him.
I think she did when she was doing the child's play, she does this da-da, and that's something that she does consistently, so he
Right.
knows that sound, and that sound,
And
that
he's waiting
movement
for
means
it.
tickles are coming, right?
Right, which is great. It's a great strategy. So the person engagement, so little babies, right, are very person engaged. Then they become object engaged and they put them together. And so he's kind of at that person engaged and object engaged. The problem is he's 2.5. So we could do a lot of person engagement, but he's not going to make a lot of progress. So we want to do some object play and then go back into person and use person to bring him back into objects and to go back and forth and back and forth. So for a little guy like this, the level of play and the objects have to be at his level and have to be interesting, but they're fairly beginning level of play. And I think when we watch him play with Mom, we'll get more of a sense of what she's doing with him. And what she reports is that he likes to get up and walk around, wander around. So he's a walker. I don't know how long he's been walking. For probably a fair amount of time. But anyway, so he likes to walk around. And so his attention and sustaining to an activity is very brief. So I'm thinking with any of these activities that you've done as you watch through the SPA, how long has he paid attention to any one toy? So this one, he's moving it. He's most interested in the blocks.
With these toys.
So you're still not somebody in his world.
basically assessing the play skills. And then when you think about it, like he is interested in the blocks, but is he actually playing with it functionally? Like is he actually stacking them or putting them together? If he's not, maybe it's not the most developmentally appropriate toy for him right now, even though, you know, he's interested in it.
Mm-hmm.
I'm sorry, can I
Yeah.
ask a question? I did notice though, when you were just cleaning up that last part, I was watching him and he was watching what, not you, but he was really intent on watching what you were doing. So there's some following a routine that he was getting, which I think is
Great.
important, you know, that he was getting that. And, you know, it's something that.
That's right. So he's got
he's
potential.
potential.
The potential is there, but I think we have to be really careful about taking it from where he is developmentally. Because if we start to do a target that's too far above him, cognitively he's just not following along with us. And it makes it very hard for him to engage for very long. So I don't know, what are his targets in intervention? Do you know?
Again, we don't do intervention, we
Yeah, we
just do
don't.
one study with him.
Uh-huh.
So imitation, that's it.
So I know from his therapies and from what mom says, right now in the therapy that they're doing a lot of inside and outside, which,
Uh-huh.
I mean.
Which would seem developmentally appropriate for him,
but-
correct?
Yeah.
But it's probably a little hard.
Yeah.
at
So that's
this-
why when she does a lot of inside, outside, because now she's trying on top, under, I'm like, wow.
Right, but that's sometimes where people will begin, right? Seems like the easiest skill, but he's not even intentionally dropping to, right? So that can be, you can work on that and engage with that in a routine, but it's probably not where we would start.
And from a language component side, that it could be difficult for him to understand those concepts. Those are difficult, you know, higher level thinking concepts at this age for him to understand.
Positional language.
Let's watch Mom, but we'll turn the volume up on. I don't know if it has to be on both.
Oh, yeah, no,
Because so Mom is doing the best that she can based on what she's seen in therapy.
What's easier? Don't try not to say a word. I was really trying hard. It's hard. So, Mom, Amy,
Oh boy, I've got the setup.
you might
Can we fast forward a little bit? And listen to him. He's trying to soothe himself. That's his strategy for regulating.
Does he sit on his own?
You'll watch. Yes.
Okay.
Yeah.
The mom definitely provides a lot of that physical support.
Yeah.
Physical
I mean,
support.
he just, it's to the point where like he doesn't sleep in his own bed. He sleeps with his parents because it's that.
It's hard. Yeah.
They're never one.
You want to go inside, Mom? Inside?
So she's using physical support, which makes sense because she wants to corral him and have an interaction.
Good job.
Uses positive reinforcement, tries to structure it. She's labeling.
Justin, you want to put the alligator inside? You want to put him inside? Inside.
It's very common to ask, what do you want to do? Let's do this, right? Because it's hard to know.
No, you can't take him on. You want to take him outside.
Yeah. So we're not going to do any of that with him. We're going to do more doing, showing. So see, he's very consistent how he's holding things, all three assessments.
No, en la boca no. En la boca no. It's okay, you're okay. You're
Right?
okay.
So more of the leaning back.
And you notice
The blocks.
Uh-huh.
Blocks. You want to put them on top of each other?
Way too high, right? But, you know, Mom is right. She's trying to be creative. Whoa, what can we do with these blocks? We could do lots of things with these blocks.
Ostrich again?
But she's jumping from one thing to the next. She's trying to follow his attention, right? But nothing is getting sustained for very long. So now she's going to turn that into something positive, right? It's great. Mom's got great skills, and you know.
I love you.
So the last day we'll do some parent-mediated work. So the thing that is important about watching a mom play with her child is, well, this is what they typically would do if they had some time. And she's doing a lot of physical, you know, hugging and control because he responds to that.
Blocks? You want to play with the blocks?
He likes blocks.
Grab the block. Blocks.
But you can see there's no routine. There's no sustaining of engagement. It's really hard. So that's what we have to change.
Hug. You want to hug? Huh?
So typically he does grab her hand and go like
Uh-huh.
he is
It's
asking
requesting.
for
We're whispering, can you hear us? Trying to figure out the targets. Okay, now watch. He's going to actually go and sit on his own.
You want to play with the blocks? These are soft blocks. You want to stack them up?
He can sit by himself, but now see he's up and going. And I think that is what she's responding to. So she's holding him because it's very hard to keep him sitting for very long. So now let's turn this off. We're done with this. So I think one of the things that will happen is, how do we sustain him? So our goal is we want him to sit on the floor with toys and play and engage with us, and we want him to show joint attention. We want to have the play level, you know, consistent so that he can show us all these great skills. How are we going to do that? We have some ideas, but what would you do?
I would have things set up around the room for him, so not all in one spot. Was I supposed to answer? Oh, is that okay?
No. I think you're saying the right thing, that it's about your environmental arrangements. You've got to arrange the environment to maximize engagement. We would have them right around him, though. We want to make, like the mom was trying to make the space small by corralling him on her lap, we also want to make the space small. I might actually put him in the corner of that room with the toys and us in front of him. Because what you want to do is you want to have him sitting long enough and having some fun, enjoying whatever the play is that we've set up, so that he'll, you know, give you some turn taking, or, well, he'll engage for a few seconds at least.
I was going to say the space is also not conducive to getting his attention because there's just so much
space.
So much space.
Right.
We've been talking about that.
Like a 12 by 12.
Right. For the purposes of videotaping, they need the big space and the big cameras and all that. But yes, as clinicians, we all know we'd make that space small, and then you widen it out.
To provide physical support for his actual sitting behavior.
Any kind of like a, you know, place to demarcate like where he should sit, for example, like a little mat. Or,
Those kinds of tools work great. I don't know for him if that would. You might use your body, legs out long. You might use, we talked earlier about a beanbag. Most of the time a beanbag chair fails, but every once in a while, you know, you can use it to give him a little support, that support he's seeking. The problem is he probably won't last very long there because he'll sink into it. So you'd have to, these are just ideas. And of course, that's part of the fun of these kind of interventions, is that you stay focused on the process, where you're going, sort of where you're starting, what the goals are for him at this moment, with an eye towards the future. So part of it is just always being creative and changing. So maybe we should go through what the targets should be. And where's your data sheet? Is on page 15?
13. I think 13.
So you guys go ahead on ESCS.
Okay, so like I said earlier, we can choose either the JA point or the JA give to model for him. If we were doing this in our lab, then we would also program for a BR, probably point or maybe give. For the purposes of this training, I think we should just stick with the modeling of JA. So we can talk more about whether we want to do the point or the give. We can model both, but we should model one more than the other.
So when you say, yeah, go ahead.
I was just going to ask you, point, does point necessarily mean one finger out, or can
It
it
does.
be like this?
It does. A very clear point within a routine. We'll talk more about.
We don't even know if he's able to do this.
He's probably not at this point, but we're just going to model the skill for him.
Right.
It would probably take a long time for him to be able to pick it up, especially if it was a joint attention point. But we would also program for the BR point and even maybe shape his hand if that was necessary.
So when Amy's talking about modeling, that's what that is. It's not demanding the output. So that's very different from a program in which you're demanding the output from him. So we do something, we don't expect him to do it, right? So it's just giving him a lot of input, right, on these kinds of gestures. So we'll show you how to do that tomorrow. He's not ready to actually perform it, but we don't want to lose time in these kinds of skills. We want to make sure we're giving him enough input.
So you're basically just modeling as much as possible. That's what you're
Exactly.
saying.
That's
Exactly.
naturally, yeah,
And-
not crazy.
So I have a quick question. Him that he doesn't have a lot of eye contact, do you see that it matters when you point and he's like not even oriented?
Yeah, so I mean, we always want to point in his attentional focus. So if he's focused on a ramp, for example, then we would, get into that opportunity and point right away and label ramp so that he wouldn't have to shift his focus.
So it's still child directed.
Yeah, exactly. We're following his lead.
And you're
It's
just.
where his eyes are looking.
Right.
And so it's not so much following the child's lead as looking at what he's looking at and doing something within that attentional focus, right?
As opposed to in the ESCS where you say, look over there, because you want to see it shift his attention.
That's right, that's right.
So
Mhm.
it's a small, it's a first step towards.
It's
that
the
goal.
first step, and we wouldn't recruit attention. So we actually never recruit attention. We get children to look at us and to shift attention, but we don't recruit attention. We never would, never. I shouldn't ever use the words always and never, because then I'm always shown to not do that. But we wouldn't ever say, look at me, and we wouldn't necessarily bring the toy up here so that, this is a very common, we do the choice if we're not getting anywhere, but we don't do very many of those. Do you want the red block or the blue block, right? So we wouldn't do a lot of those. So that's...
So I think for now we can just model the joint attention, gives and points. There are a lot of other components to the intervention, so I think that will be easiest for now, to just focus on that. And we'll talk more about when it would be appropriate to model those skills. We want it to be, salient within routines, not just a random point. So we can definitely talk more about that tomorrow.
And then for play, so those are the kind of skills, right? But now, how do you even get him engaged? We really pay attention to the play level, and we're going to develop some routines. And so that will take some talking about. So do you want to talk about the play level?
Right, so we talked about that he's probably most comfortable in discriminant play acts. So a lot of cause and effect toys or things like bubbles, rockets. And as I was watching the spa again, he was actually interested in the little animals. So we can even use puppets, because that you can incorporate person engagement, but not so much, the doll coming up to life, but more like a person engaged activity with him. So we can probably think about that. And in terms of setting up an environment, we want to make sure that there's at least a few options out for him, because he seems like a child whose attention is not for very long, so he might burn through the toys pretty quickly. So his attention shifts, to a different set of toys, you want to make sure that there are other alternatives for him to play with. So again, will be the lowest play level observed was probably indiscriminate play act, where he's mouthing the toy. Highest was probably discriminate play act. So in terms of developmental level, we'll be using simple play toys for him. And engagement, he wasn't very much engaged when he was playing with mom. So engagement state at entry is probably unengaged. So we're targeting more at object or person engaged. So pick out toys he would most likely be interested, and also having those songs or tickle games that he might enjoy. So we were actually thinking of either the song that mom was singing or asking mom so we can kind of learn it beforehand.
The burrito? Or is it the one? Yeah.
Yeah.
It's like a Hispanic, it's a Hispanic song that everybody.
Yeah, because at the
So
beginning.
we'll learn it.
Yeah, we'll learn it tonight.
Yeah.
Mom kind of started singing that song to get him regulated. So I think it's a good song for us to learn to be one of the person engaged activities that we have for him. Yeah, or other songs that that he might like.
I think that's pretty much what mom sings to him, and
That's her go-to song.
that's her go-to song when he's really upset. She's just like, okay.
Yeah.
Right. So tomorrow then, Jilly will model the engagement. And what's really important in the first session, I'm setting you up, sorry, is to have success. Now, success can be measured in a lot of different ways, but we want to have success. We want mom to walk out of there feeling like, okay, I see this moment of a change. So I think we're going to try to train therapists first, because you need to know the intervention before you can actually teach parents to mediate the intervention. So tomorrow we're going to focus on therapist training, and then the next day we'll actually back mom in. Now normally this takes weeks, right? But we're going to just hit some main points today and tomorrow and the next day.
But we might have mom in the room for tomorrow just because he's a child
Yeah.
who has problem with transition. So
Yeah.
the first couple sessions that might happen,
Yeah.
and that's okay with the parent in the room.
Yeah.
What's usually the training length, so that you do your intervention sessions with the child alone, then with the parent training, and what's typical, or is there typical?
Yeah,
Right.
not always. So parent-mediated studies that we've done, it means the therapist are already trained up.
Right.
And they would mediate through the parent, and depending on the child and the parent, you might mediate everything through the parent. For other children, it may be a balance between the therapist working with the child and the parent kind of together. We're always together.
You never do parent therapist without child?
Parent therapist without child? Oh, no, that's parent education.
Okay,
We
so
do that in
different.
studies where we compare the two,
Okay.
but no.
Okay.